Okay.
All right, and let me set up the recording. All right, we're all set.
Okay, great. So just a reminder to everyone that we're being broadcast and live streamed and recorded. So welcome everybody. It's great to see you all this new year here. Hope you all had a good start to the year. So we're going to be following the agenda. So I just have a little business to get through, and then we'll do our election of officers for the next year. So you've all seen the agenda. Anything that you'd like to add to that? All right. Going on to approving the minutes. Can I have a motion to approve the minutes? Sheila? And a second? Jan? Any discussion about them? Maria?
It says, and now I'm trying to locate the paragraph, something about the transition, the transfer of the chair, and it says that it was acknowledged, but I believe what it was presented to the board for review, because we were going to vote on it today. So it sounds like it was a fait accompli from this paragraph, but I think it was just a presentation of the slate. So if we could just change that so it reflects that there will be an election.
Okay, I'll make that change.
Thanks, Tara.
Okay, any other discussion? Sheila?
This is just reaching out, a comment to you, Mary, to thank you for dropping off the appreciation bags. It was, I was out when you did that, and when I got back and seeing the bag, you know, at my door, on my doorstep, was really lovely. So thank you for that.
Yeah. Oh, you're welcome. That was very fun to do. Thanks.
I saw you on my ring doorbell at work, and I'm saying, who's this woman at my door?
Bearing gifts, yes.
Oh, it was December. Yeah.
That's right. Good, thank you.
Right.
Any other?
I could just
Larry?
the letter that was from Frank was very much appreciated.
Great.
In the bag?
Yeah, there was did nobody else get a letter from?
Yeah, I just didn't know if it transitioned to something else. Yes, the letter was very nice.
It was a lovely, lovely gesture, and thank you all.
Great. So all in favor of approving the minutes then with those corrections? All right, great. Passed. Good. Any privilege of the floor? I don't think we have any guests. All right, so we will move on to the election of officers, and we're all familiar with the slate. For Maria to be chair and for Elise to be co-chair. So I'm wondering if I can have a motion to approve.
Co-chair or vice
I
chair?
believe it's vice chair.
Vice chair.
Yeah.
Great.
Thank you.
Yeah.
Vice Chair. I so move that we nominate that slate.
Great. And second? Travis? Okay. Any additional discussion?
Just gratitude.
Yes.
Well, and gratitude to you, Mary. You've been wonderful and
Oh,
an excellent chair.
Oh, I appreciate that.
Agreed.
Thank you. So all in favor of approving the slate? Okay, it is passed. All right, and I will transition to Maria.
Thank you. And I did want to start as well, as many people here have said, Mary, by thanking you for your leadership over the past 2 years. I feel like you have modeled for us and encouraged a culture of openness, compassion, active engagement, and graciousness, which has made being part of this board very productive. I feel like we've done a really good job over the last couple of years, and it's been a great pleasure as well. So I know I have big shoes to fill, and I look forward to trying to do that justice. So thank you.
Oh, could I just add what a pleasure it's been for me too. I've really enjoyed getting to know some of you better and to learn about your expertise and your talents. I've really appreciated how everyone has participated, and whether it's through these meetings or through small groups. It's been great to work with all of you, and I've especially appreciated your patience as I've learned Zoom in this process, and how to notice when someone's got their hand up and not making. Whoops. Did I do that? But anyway, I appreciate your patience in this process too. When I started this 2-year term, it was a couple of months before the pandemic started, and I didn't expect to only have 3 in-person meetings throughout the 2 years. So it's the way it is. But thanks for sharing the experience with me.
Well, thank you. Okay, so we actually have on the agenda, we have next the subcommittee leadership discussion, but if it's okay with everyone, I'd kind of like to flip that a little bit and talk for a second, do the chair's report first and then the leadership discussion. Because if that's, does anyone have, is that okay? Is that okay? The reason for that is that there have been a couple of discussions over the past month, both in the nominating committee and then with the administration of the departments, about how we go about electing the chairs of our subcommittees. And if you read the minutes, or not the minutes, the bylaws, which were sent out with the agenda, and which I unfortunately can't open because I don't have the right software on the computer that I'm using. There is a process outlined in the bylaws for how to go about nominating and electing officers to the subcommittees. And that process involves an election. So it can be a little awkward. No. Go ahead.
Are you sure? I thought the bylaw said it was appointed by the chair.
Yeah, that's what we thought too. But then we reviewed the bylaws, and in fact, they say that the subcommittees are supposed to elect the chair of each respective subcommittee.
Are you sure you've got the right? Well, go ahead. I'm just looking for.
Okay, we did pull them up at the last meeting that we had. So if I'm wrong, this would be a good time to step back and rethink this. We had proposed this anyway as a way of kind of reinvigorating the committees. And so one of the things that we had talked about was how to move forward with that process. We talked about that in the nominating committee, and then with the administration of the departments. And what the public health department does is, Frank on that board is actually, I believe you said you're the secretary, is that correct? And so the meeting is temporarily handed over to him to handle the election, and then once the new officers are elected, he hands them back to the new officers. So we were thinking something similar for the subcommittees, and that was really what I wanted to report on. And that leads us into our discussion about subcommittee leadership and how to best go about, especially now that we are looking at our bylaws, piloting a system that feels like it would be a good system to then think about maybe putting into the bylaws as the way that we would like things to go work moving forward. So.
Oh, you're right.
that's-
No, you're right. I'm looking at it. Yes, as one of the members of the subcommittee shall serve as subcommittee chairperson and shall be elected by members of the respective subcommittees.
Yeah, I
Yeah.
think I was perpetuating the wrong information because I was dead set that it was appointments of the chairs, and then we did read through and we saw that that was not the case. So I don't know where I read it. I swore that I did, but obviously was incorrect. So I apologize if I led you guys astray.
Well, and I think, I mean, what I recall a few years ago, shortly after I joined, I remember, there have been other than members of the board that have chaired that. My recollection is that it was often difficult to get people to do that because it also required that they attended the CSB meetings, even though they weren't CSB members. So that's just to keep that. I mean, I'm all for it, particularly since I think there would be a much better person to chair the developmental disability subcommittee this year than me. But that is something that we have to keep in mind.
Yes, Larry.
Yeah, and to that point, I think we, and Elise, you can pipe in as well. The the DD subcommittee, it has been hard to get a chair, and Elise and I, decided to co-chair at one point. Kaki, you've graciously agreed to do it, but
To co-chair with you.
yeah, right. So because people are really busy, and some people are just not interested in chairing, or they're not available to chair. So I don't know if the other subcommittees have struggled with that. I think the co-sharing is an option that we've used, and I think used effectively. But just this past subcommittee meeting for the DD subcommittee in December, I wasn't available. Elise wasn't available. You weren't available, Kaki. So I had to reach out to James, and James graciously did it. But I don't know whether James would be someone who would be interested in chairing.
Well, the difficulty lies in the fact that we decided that funded agencies can no longer be members of the subcommittees. So if we're limited to members only who can chair the committees, then we can't use anyone from a funded agency, which is almost every single person who attends DD subcommittee is from a funded agency. And so we're really, really limited. It's basically you, me, and Kaki. And there's a there's a couple of parent representatives, but I don't believe either of those people would be interested at all in taking on leadership. I don't think I've heard either of them utter a word in all the many years that I've been on the subcommittee. So
the rest of the DD subcommittee, it's only James that's funded agency, right? A representative of.
He's terming out, and then he's done because he was already approved to be a member when we made the change. So
Yeah.
we finish his term. Yeah.
Well,
Yeah,
and
I
that
was
may
just
be the
clarifying because
conversation.
I thought for a minute you were saying that there were others on there that were.
No, I'm just saying that in terms of the people who are interested and invested in these subcommittees, the vast majority of them come from funded agencies. So we've really limited the pool of people that can take on leadership roles.
Well, and that may be the conversation that we really want to have at this point, Maria. Because when I had a little more conversation about that with Jed, was that his name? The attorney from the state organization. He was surprised by our making that decision, and sort of felt that we should reconsider that. And maybe as I recall, our initial concern was about the board itself, and then we extended it to the subcommittees. Maybe we want to rethink some of that, particularly because I just noticed we've got a huge number of vacancies on the subcommittees, while making clear that people need to recuse themselves when there are conflicts of interest and such. I don't know. Do we want to revisit that whole conversation? None of that's in our bylaws right now anyway. That was an agreement we made, with an expectation of changing it in the bylaws.
A couple people have had their hands raised. Yes, Larry, you had wanted to say something.
So, I wonder if, we can't really, I was gonna say, can we resolve the issue around who's gonna chair what before we have the discussion, but about the parameters of who can be on the subcommittees, I would support allowing members of funded agencies to be on subcommittee simply for the reason that people already described. And also I'd express sympathy for the committees who struggle to find chairs. We haven't had that problem in quite a long time on the subcommittee, on the health subcommittee. A little joke.
Yeah.
A very little tiny joke.
Yes, Jan.
I was going to ask Frank, I thought the county attorney looked at this situation. Maybe I'm confusing it with something else, but I thought the county attorney looked at it and agreed that it was a good idea not to have funded agencies, but maybe I'm mixing that up.
Yeah, so where he said where there would be a prohibition or a conflict is if there's decision making. So that really lies with the board itself. His position was you could go either way. You could make an argument that there is an inherent conflict on being on the subcommittees as well, or you could not, and you could say it's okay. So from the county attorney perspective, he was fine with the subcommittees. It was the board itself because of the decision making there. And quite frankly, he even said you could potentially overcome that on the community services board by having those folks recuse themselves anytime something comes up regarding them. I always struggle with that, right? Because if you're going to recuse yourself from one vote that's related to your organization, you would almost have to recuse yourself from a vote that affects any other organization, because it's the same pots of money. There's similar work going on. So it's more of an internal struggle for me. But sorry, to answer your question, he said the community services board, it was a little easier to say, yeah, there appears to be an inherent conflict. With the subcommittees, he said it could go either way and the board would be fine in either approach that it took.
Thank you.
Yes, Paula.
So I think it makes sense to think about opening up the subcommittees again to people who are with funded agencies, partly because it would be nice to have more people on the subcommittees, and also because, I notice quite often that we'll be having a discussion and we'll say, I wonder if that's true for Family and Children's Service. And if we had somebody on the subcommittee from Family and Children's Service, they could probably tell us. So I think there are a lot of reasons that it would be useful to have people from agencies on the subcommittees.
Yes,
Sheila.
I agree. Yeah, I agree with what Paula is saying. Based on certainly the experience that I've had and others here with the DD committee, subcommittee, we're struggling with membership, and we're struggling with who's going to chair. As I said, CACI graciously has stepped up to do that. So I think we should revisit it. I can't speak for the other subcommittees, though.
Stu?
Yeah, before we had this discussion a few years back on the substance use committee, we always thought was not a good idea to have the head of CARS, the head of the Alcohol Council, be a voting member. So they come to the meetings anyway. But some of their staff over the years have been members of the committee. And then when we went to, you can't do that anymore. Being on the nominating committee, it was obvious that a lot of folks who were doing that, we have to now fill a lot of vacancies. I think we've had the most vacancies this past year, not necessarily because of that. I mean, give some credit to your favorite subject, Frank, the COVID. That's kind of created havoc in a lot of people's lives. And who wants to go to a meeting? Who wants to go to a meeting on Zoom? But yes, I would definitely be all in favor of having subcommittees once again, and have folks from different agencies, but again, not the head of the agency. That seemed to be, you know, in the committee that I've chaired over the years, substance use. They get their 2 cents in, but they don't vote for anything. And as Frank says, the real vote takes place on the board level. And, you know, we don't, I think we've been pretty strict about having board members not have agency or ties when you're on the board. But the committees, like let's open that up again.
Yes, Elise?
And I would argue that it probably, I mean, in my experience, we've had executive directors, you know, Liz Smith, the executive director of Unity House, has attended for many, many years. It's never been problematic. In fact, it's often been, you know, really informative. And, you know, I'm not sure in my experience, I can't recall a time that we've had an executive director that was a voting member. But I wouldn't be opposed to it, only because we have no real authority. I mean, what are we actually, we have no authority over anything. If we vote on something, it's usually very perfunctory. I think the most important decision-making process we go through on an annual basis is what our goals are going to be for the coming year, which is always kind of nebulous, and then they kind of disappear and then they come back in the spring. And so, you know, I just don't see a real risk there. There's no risk because we're not actually charged with any responsibilities.
Yes, Jackie?
I'm just going to note that as this sort of co-chair model has been used, and I think mostly on the DD subcommittee, and I think in the past, Jan, hadn't you sort of done a co-chair thing for a while before you stopped? But at any rate, the whole issue of the chair needing to attend the CSB meetings, if there was a member of the CSB who was sort of the co-chair, you know, that would take care of that, and that might make it a more attractive position to non-CSB members.
Another thought, I'm recognizing myself for a second, is that maybe it doesn't have to be the chair who reports out to the board. So the chair could delegate.
The bylaws does speak to that.
And what does the bylaws say about that?
That's what I'm just looking for. Let me go back there.
Yeah, it does say that the chairperson shall be required to represent the committee at the mental health board and executive committee meetings.
Right, but that's where I think like this sort of co-chair idea or something might help with that if it wasn't someone who wanted to also attend that meeting. I just have a recollection of that making it difficult often to get people to chair in the past.
Well, and is that something that's required by, is that something that we establish as part of our local county bylaws, or is that something that is required by the state?
My guess is that that's statutory language, but we'll check on it.
Yeah,
It just doesn't seem likely that we would have come up with it from, you know, whole cloth.
Yeah, I don't believe the statute does speak to, it only speaks to the formation of the subcommittees. I don't think in fact, I looked because I was trying to see if there were, that's where I read that the chair gets to appoint them. But it's silent to the chairperson or leadership of those subcommittees, just membership and the number.
So just
and
to clarify, for my purposes, it does not say that the chair needs to report to the board. That would be a county bylaws.
Yeah,
That's in our current
I
county
believe
bylaws.
that is accurate.
Okay. So that's something that if we thought there was if that was a barrier for people not on the board who wanted to be in leadership positions of the subcommittees, we could rethink that. Is anybody else? Yes, Jan.
I don't think I ever did co-chair unless I'm forgetting, when I was on the DD subcommittee. And then I just stopped when I became chair of the board. But what I was going to say is, it seems to, another issue just seems to be getting the members of subcommittees to engage. As Elise mentioned, a couple of those people who are parent representatives were on it when I chaired it. And there were a couple others as well that have since gotten off of it. But they just didn't seem engaged or interested. And I just wonder, like, what is there something different we should be discussing, or should we? I know we have to discuss certain things and follow certain rules, but I also feel like it's just overwhelming to someone who isn't in the field and yet has has an interest. I mean, somebody who's the parent of a child with some type of disability would be very interested in the field. And yet I feel like the gobbledygook of all that we talk about doesn't really allow that person to speak. Not literally doesn't allow them, but doesn't give them, the room to really speak about things. Does anybody else feel like that's an issue, or not so much?
Yes, Elise.
Yeah, and I think that's another good argument for, going back on our decision not to let funded agencies be members, because one of the things I think I've seen less and less engagement as we've made that change. And I think it's because we're accidentally making the subcommittees irrelevant. Because, for myself, for example, chairing the Developmental Disability Subcommittee, I've been out of the field for 12 years. And I'm informed, but that's not the same as being on the ground every day and really caring and knowing what the hot button issues are. And I've noticed the engagement, kind of decrease the more we separate ourselves from, the real on the ground work of human services in this county. And I think just allowing, having a chair that's actually an agency representative, that's going to increase engagement and relevance of a lot of the things that we talk about. I also think they are really good at engaging stakeholders. It's a big part of what they do, and we could probably take our lead from some of them about how to do better.
Yes, Kaki.
Mary, I was going to say, I just took a quick look at the statute. There isn't anything in the main section, but just like before, I had missed something that Deb pointed out to me. There's a whole nother section that talks about membership and that kind of stuff. So I will tomorrow look at the different sections there and make sure that there's nothing in the state law. It may just be the charter, and in which case that's part of what we suggest to the county, that they change in the charter as well.
Thank you. Yes, Larry.
So for purposes of the functioning of the subcommittees, would it be, for my subcommittee, would it be okay if we went ahead and had a vote in January about who we want to have as chair? because I think we're ready to have that discussion. I broached it with the subcommittee, and granted, there wasn't a quorum, but nobody said, oh, we should wait. I mean, I would just like to get that done. I mean, I guess it doesn't really matter.
I don't know, do you have a candidate, Larry?
Well, I
Other
mean,
than myself.
I mean, I already said that I'm interested, and nobody went, oh, instead I want to do it. So
I think it's well known how much you love that role though, Larry, and that I think that's great that you love it so much and that you do
Yeah.
such a good job of it, but that may intimidate some people from even mentioning that they might have an interest. And that's probably true of the other subcommittees too, that if you have someone who's very experienced and well-versed in the field and does a good job leading, it leads to everyone else feeling like they just not do as good a job and shouldn't try.
well, I could withhold I could say, I could suggest that, just to respond to what you're saying, which I agree with, I could suggest that I don't put myself forward for the chair and see, and I would send an email out and ask people to think about it. And if there are people who are interested, maybe we'd hear. I mean, I don't want to be intimidating, so.
No, I don't think you are intimidating. That was probably.
No, I understand. I really am trying to, when I open up the conversation, it would be good to have somebody else who said, oh, I might be interested. So let me send out an email to the subcommittee and say, so I'll do that and see what happens.
Before you do that, and Paula, I do see, so I'll get you in just a quick second. One idea that arose, and again, I'd like to present it to everyone and see what they thought. This came up at one of our nominating committee meetings, was that the members of the nominating committee could each take a subcommittee and be the person who is the point person, which could override some of that. If someone doesn't have to come to the person who is the chair and say, I would like your job, that might.
Sure.
Yeah, that was just an idea that came up. So I
Sure.
just wanted to present that to people. Paula, I'm sorry, you had something you wanted to.
Yeah, I was going to say that with someone like Larry, who has been the chair for such a long time and has so much experience in the field and in organizing meetings, we all love having him as the chair. It's great. I do think that you do want to develop new leadership, and that one way to do that, Larry, is to have a co-chair.
Okay.
But not a co-chair who just takes over when you're not there, but to have somebody who actually works with you and, gets the experience of how do you plan a year's worth of meetings around various issues, and who are the stakeholders who need to be, just all of the stuff that because you've done it forever. And I think that would make it much less intimidating to someone to be willing to be the chair after having spent some time working with you.
What just occurred to me is maybe Maria and I could have a discussion on how to phrase what you're suggesting and send it out, because I'm pretty sure that there are people who would be interested in learning how to do, and also there already are people who know how to run a meeting. And so maybe having a chair and co-chair would make that, and we could work it like we work it on the community services board.
Where there's a period of time where the co-chair or vice chair or whatever you want to call it is kind of in mentoring, if you will, from the person who currently has the position.
Yeah.
Is
Because,
that what you're suggesting?
yes, that is what I'm suggesting. And also, like I said, there already are people on the subcommittee who could pretty much quickly figure out what to do. So, we can talk offline about how to phrase it if people are okay with having that as a process.
Okay. Stu, did you want to add something?
Yeah, well, we also talked about in the nominating committee this process of how the board chair stays there for 2 years, and there's a vice chair, knowing that person has 2 years to learn how to be the chair. In the committee, in substance use, whenever I had an unofficial co-chair, if I was sick or out of town, I couldn't run the meeting, I would call Tom, and Tom would run the meeting. So he had experience in that. And every year I would ask members of the committee, do folks here want to be able to chair this? And up until last year, didn't have anybody who showed any interest at all in that. And that was Tom. He wanted to try a little different direction. And he did that up until, I guess, the October meeting. So when we came up with, Jan was talking about, I forget how she put it just now with Larry, might be an intimidating figure to run against, or I want to be the chair, but no, Larry's been doing such a great job. It might be a dirty word, but term limits on the chair is allowed. Term limits on the chair for the committees are not allowed. So my suggestion is think about having the subcommittee's chairs have a term limit. You know, it's 4 years, so maybe 2 terms, so that's 8 years or 12 years, whatever. This way, the committee knows that the chair cannot be the chair forever or in a certain period of time. And I think that's going to spark some interest. Well, when this person leaves, I think I might want to put my hat into the ring, as well as having the idea of having a co or a vice chair for the committees. Again, unofficial in the committee that I've been running, but it was kind of known on the committee that, you know, Stu's not there, Tom's got the meeting. So if we had that system kind of set up in the other 2 committees, officially or unofficially, as well as knowing that the chair for the subcommittee is not going to be the chair for more than 12 years, that might create some interest in the folks who, well, I don't want to do that because, you know, Larry has been doing a great job. Stu, you know, knows what he's doing there, but they're leaving. They have to leave. Just like when we were looking for different chairs, you know, as the nominating committee does, we approach people. Do you want to be the chair in 2 years? Right? Maria and I had that discussion. She was kind of on the fence 2 years ago that she wanted to do that, the time commitment. And everybody that we've nominated, it's not a instant, oh yeah, that's a great idea. I think the leadership, there are certain folks that just step right up and want to do that. And then there's others that are just interested in attending the meetings and putting their input in and really not doing a lot more work that's required as chair for a yearly basis. So the 2 suggestions is kind of a term limit on the chair, as well as having a vice chair in the committees. I'm done.
Yes, Larry.
I really like that idea. I think we should model the chairmanship of the chairpersonship of the subcommittees on what we do on the board, because there's a reason why we do it on the board, which is because we don't want somebody to consolidate their power, you know, such as it is. So I think it makes sense to do a similar thing on the subcommittees.
Which sort of brings us back to our initial question, which was, we have not, as far as I'm aware, been holding elections on the subcommittees for the chair position, and the bylaws specify that that is how we should be doing it. Do we need more discussion about the process of that? Do we feel that that is something that, again, a proposal that was just sort of thrown out there for discussion was that the nominating committee currently has 4 members, and there are 3 subcommittees, including the nominating committee, which I think has its own separate discussion, because that's also a piece of this. But right now there are 4 members of the nominating committee and 3 subcommittees. So we could ask the nominating committee members to pick a subcommittee that they are not on, and solicit interest for the chairmanship from people on the subcommittees, and essentially run the election, so that we are following the bylaws, and then we can, for the moment, it's kind of a workaround to this process, that it might be intimidating for someone who doesn't have experience or doesn't have the same level of comfort with the meetings that the chair has had. It might offer them the opportunity to be able to throw their hat in the ring, such as it is.
So would we be asking for a co-chair or seeing if there's someone interested in co-chairing at the time that we're running an election for the chair of the committee? Sorry, I missed the last nominating committee meeting, so I'm just not sure if we're saying what we're saying.
Well, actually, the co-chair discussion came up for the first time at this meeting. So
okay.
It sounds, I think, like an idea that a lot of people think has a lot of value. And we just have to think about how that co-chair, because as far as I'm aware, in the bylaws, there is no co-chair role that is specified. So there's no way to figure out who that person might be. So there's lots of different ways to do that. I mean, you could elect a chair and a co-chair. You could elect the chair and have the chair solicit someone to be their mentee that they would work with over the next period of their term, whatever it was. So that person would have experience. You know, those are just the 2 that pop to the top of my head. There may be others. Yes, Kathy?
Just going to suggest that since you're sort of cold calling people, I think asking if they might be interested in being chair or a co-chair might elicit more positive responses, or from some people that aren't so sure, but oh, maybe I'm willing to dip my toe in, but they would have said no if the question was just about being a chair.
Yes, Larry.
I'd be happy to, well, I'd like to suggest that I could continue as chair for whatever the 2-year period would be. And so then the issue would be whether the nominating committee could find somebody to co-chair. I mean, I don't think there's anybody on the subcommittee who's raring to be the chair. So maybe if I said I'd be the chair for, 2 years, and the and then cycle off and be replaced by the vice chair. If that's helpful, I'm willing to do that. I'm also willing to not be put forward as the chair for this year. I mean, whatever the nominating committee decides.
Yes, Stu?
And just a point of edification, I would prefer to call the new position a vice chair as opposed to a co-chair for the subcommittees.
Okay, and Travis, you had also had something you wanted to add?
I think if you're going to open the subcommittees up to more agency, folks, I think the idea that it would be an appointment sits less comfortably with me than an election.
Yeah, it would.
I just think there's a possible risk there. It probably wouldn't happen, but feels cleaner to me if it's just an election for all.
Yeah.
Lots of people are nodding heads. So do we, it seems clear we need to hold elections for the chairs of the subcommittees, given that that's in our bylaws. So there's two pieces of this. Are people comfortable with a member of the nominating committee choosing a subcommittee and being the person that runs that election?
Yes.
Is that something to vote on, or can we just say, yeah, we like that idea? Nobody has a strong opinion.
Yeah, we like that idea.
We like that idea. Excellent. Okay. So as the nominating committee, we will, the four members of the nominating committee currently are myself, Mary, Jan, and Stu. So we will convene and figure out how we're going to organize these elections. And people are comfortable with that?
Yes.
Okay. All right. Yes, Khaki.
No, Maria, I was just to say the other issues about whether we create some kind of official co or vice chairs, whether there's any term limits, those kinds of things can be sort of passed off to the bylaws subcommittee, to be added to those discussions. And we had said at some point, we'll bring back multiple options for people to be looking at. So we can certainly do that.
That sounds good. And then we can bring that back to the board when we discuss that after the bylaws. Okay. I think is there anything further that people feel, have we said what we would like to say about this? Okay, cool. So the next item on our agenda is the subcommittee chair reports. So I don't know how we usually do this, alphabetical order. Let's start with DD. Is there a report on?
Yeah, there is.
We lost you, Sheila.
You muted yourself again.
You're muted.
Sorry. I couldn't chair, Lise couldn't chair, Kat couldn't chair. As I said earlier, I reached out to James Beaumont from Unity House and he graciously accepted it. So after the meeting, I asked him how it went. He said it went well. The main agenda item for the December meeting was discussing staffing incentives and retention. And he told me that through an email, that was a very productive meeting. I don't have the details. I'm waiting for the minutes and to kind of get a better sense of what strategies they discussed in particular. But as I said, it was great that James kind of stepped up and conducted that conversation.
Thank you. Mental health subcommittee.
So the main agenda item was a discussion with the new executive director of Family and Children's Service about the state of their clinic. And they are like our clinic, they are getting there's an increase in demand for services. What they're not getting is they're not having the kind of staffing problems that we and other clinics are having. So that was good to hear, but they are, their waiting lists are long. So that's the key thing. I think we also, I made sure to invite somebody from Family and Children's to come regularly, and the new executive director seemed interested in that, not herself, but in having somebody represented on the, or having somebody attend. I think the issue of whether people can be members, resolving that will help to bring more people to the mental health subcommittee. We had some, we didn't have a quorum last month for a couple different reasons, but we usually don't have a problem with quorum. And people from partnering agencies do come, but they haven't been coming as regularly as they used to. I think part of that is related to COVID and related to how busy people are. The other thing we talked about was the news release that went out announcing the changes to intake given the staffing problems. So I don't know where we are with that, but as you know, it's not going to be a long-term thing. This, I think Harmony said something like 2 months. Is that correct, Frank?
Yeah, our original announcement was through the end of January. Our hope is it won't be that long, but we're still recruiting.
Right. So I imagine that Family and Children's is for whatever reason, is an outlier in terms of not having enough staffing. I think particularly public mental health clinics are probably having a difficult time all over the state keeping staff when so many options like doing telehealth or retiring or going more into private practice is such an attractive option. And one of the things I was going to try to talk to you, Maria, about this. I suggested that, and in a conversation with Harmony, we're suggesting together that we have a meeting of the Community Services Board where as part of a regular meeting, where the discussion is about workforce retention and workforce, how to figure out how to be helpful in terms of getting people interested in the field here. Instead of having 3 separate subcommittees talking about it or trying to set up an extra meeting, one of the meetings this year could be devoted to talking in a focused way about all the workforce retention work that the subcommittees are doing and the issues for each of the disability areas. I think that's
Okay, thank you. I think that's a great idea. And actually you are foreshadowing our proposed agenda setting for 2022. So we'll come back to that as well when we talk about that. Elise, did you want to add something or wait till we get to our...
No, I'll wait till we talk about agenda setting.
Okay, cool. Substance use subcommittee.
I don't have many notes from that meeting. I came in a little late to that, and the piece that I remember was the discussion of how the field is really losing a lot of people in it It's tough to find members to be on the subcommittee. It's tough to find folks to work for the agency. So how do we strengthen the recruitment effort, advertisement, pooling resources? It's been an issue I've seen, for a number of years. I think it's only gotten worse. And then we had a number of people tell their stories as to why they got into the field. Some were inspiring, some interesting. People didn't really know, oh, that's why you're here. That's why you have a particular interest. And I think more of that kind of discussion to create a little bit more of a snowball effort to find folks, not just for the committee, but to be active in the field of which was once called substance abuse. Now it's substance use. The amount of folks going into the field, particularly the CAC credential, has been dismal. It's been really low. That usually was a kind of a gateway that you didn't need much college to be able to get your CAC, working for an agency, doing a lot of volunteering. And then a lot of people would then catalyst to go on to a 4-year degree, MSW, a lot of different fields. So that kind of discussion took place. And I think there's more of that to come. Our January, we've set a couple of agendas out there. The January one, I forget the guy's name who's coming, but he's going to talk about the effects of the cannabis regulation. I got a Dr. K. I don't remember the last name. Do you know who that is, Frank?
Yeah, it's Dr. Claybeck, our medical director at the health department.
Okay. So that got a lot of folks interested in attending that meeting, and there were discussion about sending out links to various different agencies to hear the results of Dr. K's. I guess he's done some research, and he's going to present how that's working out, not only in our county but in New York State.
Okay,
so
great. We'll look forward to hearing about that.
Yes.
Next.
So as you folks know or may not know, Tom left kind of quietly the chairmanship. I think he informed Frank, but very few of us knew that he wasn't going to be there. In fact, at the meeting, I was busy trying to get him on the phone or on the line. And where are you, Tom? Aren't you chairing this meeting? And he says, oh, no, I retired. I quit. To our surprise, Harmony and I both didn't know that was what was occurring. So I said that I would step up and finish out this term and go through it for at least another year, and kind of shake the bushes and see from the committee if there's other folks interested in chairing the committee. But as Larry said, I agree to keep the chair for at least in 2022, and then see if we can get somebody else to take that over.
Okay, well, thank you. So next on our agenda is the commissioner's report.
Thanks, Maria. And I wanted to start by offering my thanks to Mary as well. It's been a pleasure. These last couple of years have been anything but normal. And so she's had to chair with a little less attention from me. I think we were without a deputy for half a year or so in there as well. So she did an amazing job, and I just wanted to publicly thank her for her support. Harmony can't be with us tonight, and part of that is because we had an incident here at the department today. Folks might have seen we have issued a press release about it. We had a client come to the building that was in an agitated state, did a little bit of damage to the lobby. Our staff and the special response team and the crisis negotiating team all responded and responded well. It resulted, the incident resulted in a barricade situation in our lobby, but all of the staff and law enforcement did an excellent job in resolving it safely, so we could get the client where they can get the appropriate care. So just wanted you all to be aware that that occurred. We have been spending the afternoon talking with the staff immediately involved. We also canceled all of our appointments this afternoon. One, so folks weren't coming to the building, and two, to give the other staff in the building a chance to process what had happened. We will be holding an in-person, not an in-person, but a virtual debrief tomorrow morning with all the staff. We had a training hour scheduled that we're going to repurpose for that. We've offered the employee assistance program to all of our workers, our staff as well. So just wanted you guys to be aware of that, and know that your team and the law enforcement folks that responded did so professionally, with compassion, and ultimately resolved the situation so we could get the client the care that they needed. So that was our day today, and probably a bit of tomorrow as we process through that. Harmony wanted me to let you all know that she's finishing up the contracts, getting that worked out, and she's going to work to try to figure out and bring the information to all of you about the contracts, what's in them, and make that a process that you guys can be a part of as we go forward. And then our recruitment efforts are ongoing. Larry alluded to it. We do have a new clinician starting on Monday, and we are still actively recruiting to fill some of the other positions. And then two of our folks are on extended medical leave that we're hoping we'll have back soon as well. So things are looking positive, but we definitely still have a ways to go and need a few more clinicians to join the team. Travis,
Travis, did you?
I'm curious, Frank, did the shift in requirements lead to increased applications?
That is a good question, Travis. I don't know the answer to that. I'm going to guess probably not with the holiday season, but I'm hopeful that will shift as we're now in the new year, and folks are a bit more focused on these kinds of things. So I'm hopeful. Quite frankly, I don't think anything simple is going to make the difference. I think there's a lot of work that we need to do to get people's attention, let them know that we're here, talk about the benefits of working in our clinic and how all of that goes, and then hope that the changes we made smooth the path to them joining the team. And I think that's really all that I have from a report perspective, but I'm happy to answer any questions anyone has.
Are there any COVID updates that it would be helpful for the board to be aware of?
There are always COVID updates. Yeah, so lots going on there on that front. Mainly, we're transitioning now. We're transitioning in several ways. First, in our community, Omicron is becoming the prominent variant, which so far for us is well, I don't know that a variant is ever a positive, but we're seeing less severity in illness related to Omicron, and it's playing out in our hospitalizations here. We're able to track data on the hospitalizations, Much of what is inpatient is still Delta variant. We are down to 10 or fewer folks in the hospital. So things have started to level out there. And I do believe that as Omicron becomes the predominant variant, we will see that trend continue with the hospitalizations. We're also in this transition period where the CDC made the announcement about going to 5-day isolation and quarantine. They made that a recommendation in a press release. They have not issued new guidance yet on isolation and quarantine. So we're all waiting with bated breath to see what that guidance will actually look like. New York State will not make the shift until that guidance is provided, including the data behind it. What I will tell you is I support that shift. We were already thinking about locally what we might have to do in this first quarter of 2022 to adjust. The volume of cases with Omicron, because of its transmission rate, it really has limited the effectiveness of health department coordinated isolation and quarantine. It's just the volume is too high. By the time we're getting to folks, oftentimes their isolation is almost done or their quarantine is almost done. And it's really not intercepting the disease the way it was when we were able to do it more quickly earlier on. And it's also leading to unintended consequences. With the 10 days of isolation and quarantine, with the transmission rates the way that they are, it will result in de facto shutdowns. Not government ordered ones, but simply there won't be employees to work. I think K through 12 is the first place we're seeing that, but it will eventually make its way to our local grocery stores, our first responders. If we don't make adjustments, we're going to have de facto shutdowns. And based on what we know at this point about Omicron, those shutdowns would likely have more significant health and wellness impacts than the disease itself will. And that's a balance we as public health professionals have to deal with. And it may feel like we're giving up or it's not as important as it was, but that's not the case. It still is just as important, but we have to balance the impact of our public health interventions against what we expect the disease that we're trying to intervene on will have on our community. And it's difficult conversations to have, particularly when we spent the last 2 years, asking everybody to do everything possible to, limit the spread of the disease. This is a shift, and it's a shift to self-responsibility. Whereas rather than the health department being the intervener to change behavior, we're asking our community, if you test positive or if you have symptoms, please do this, right? Isolate. That's what's going to have a better impact on intercepting disease transmission than an after the fact formal process from the health department. So we're going to be talking a lot about that over the coming days and weeks. It'll start tomorrow at the legislature. It's starting here tonight. We have I almost said open house. We have a town hall on Wednesday where we'll be talking about this as well. So it's a transition time, and it's going to be a challenge from a communications perspective. And really, we're going to have to work as a community to kind of adapt and understand this new phase of dealing with COVID in the community. On the vaccine front, just real quickly, we are doing second dose clinics in Lansing and Newfield this week for the kids. And then on Saturday, we just sent out a link a couple hours ago for a Saturday booster clinic, Moderna clinic. So we're doing another one of those, and we are planning those for each Saturday in the month of January. So we have the capacity to do 1,200 appointments on each of those days. So if demand continues, we will plan to do those on Saturdays through the month of January to continue creating access for booster doses. That's probably the COVID update.
Okay, thank you. Stu.
Just a quick question, Frank. The hospital, the surrounding area hospitals, COVID first hit us, you couldn't do elective surgery. You couldn't really go to the hospital for anything other than COVID for a while. My sense is that's not happening again because the symptoms and the severity isn't as deadly as it was 2 years ago. I was just looking to see if you can confirm that.
Yeah, so Cuyahoga Health Systems has not limited or eliminated elective surgeries at this point. They've been underneath the thresholds that would require them to do so based on the state metrics. Hospital capacity is a tricky conversation these days. Dr. DePlan probably knows it acutely, that it's about resources, right? The number of beds available, the number of ICU beds available, the capacity of the hospital is all dependent on demand on any given day. And they are very adept at surging and adjusting their staffing to meet whatever the demand of the moment is. So it's difficult to say there's X number of beds or there's X number of ICU slots. It's really about the resources that are available to manage that. And I have to give Cuyahoga Health Systems credit. They're doing an amazing job of being flexible in trying to address the needs of the community for COVID, continue to do all the other healthcare work that they were doing, pre-COVID, while at the same time dealing with the same healthcare staffing crisis that the rest of the world is. As well. So we've been very fortunate here locally. And so it's just that much more important that we continue to do what we can to limit the stressors on the hospital that we can so that they can be there for the other things we need them for.
Okay, thanks.
Thank you. Okay, the next item on our agenda is proposed agenda setting for 2022. And we had wanted to include this for a sort of introductory discussion and to give people time to give some thought to the things that we would like to see the board address in the coming year. So we will put this on the agenda as well for next month. But we did want to open it up to initial discussions, thoughts, and ideas about what should be on the board's agenda for the coming year. Larry.
So in addition to the thing about workforce retention, given what Frank said about an emergency at the building, it would be good to know what the emergency response is. It's sort of a description of what happens when there's an emergency at the department. And to that extent, and in addition to that, it would be good to sort of have a discussion about whether this is whether we feel like our partner agencies, what do we know about what our partner agencies do, so that we have a sense that when an incident occurs, there are procedures and policies in place that get practiced. And not that we would dictate to partner agencies what they have to do, but it would be good, I think, for us to know what happens when something happens at an agency. And I also think it might be good to have at some point, maybe in the summer, discussion, a presentation by Cuyahoga Medical Center about how things are going, particularly in relation to services for the people who we're interested in. I mean, I know we could probably ask Dr. DuPont to do that like next month, but we haven't had a conversation with the hospital for quite a long time.
As you were talking, I was also thinking the ER response discussion may coordinate nicely with the ongoing changes happening with the community as far as law enforcement response.
That was my question. Here you go.
And the transition from a couple different numbers for suicide prevention, and now this, is it 988? I can never remember what the 3-digit number is going to be, but a discussion of that and the process for doing that would be good.
Cool. Elise, you had said there was something you wanted to say for this opportunity.
I have 3 things. So I just wanted to piggyback on Larry's suggestion that we bring that workforce development conversation to this board. at some point, and also invite workforce development leadership to attend the meeting. I was not successful in getting them to respond to me when I requested that they attend. And I can't remember the new director's name. But either, you know, the director of the One Stop, or the president of or the chair of the Workforce Development Board, or both, to come to a meeting and talk about the crisis in direct support workforce and healthcare workforce, and see if we can engage them in that conversation a bit more so that they can bring their resources to bear on the problem. The other thing, I would just like to continue the conversation about employment service options in Tompkins County, just keeping our eye on that, seeing how it's going. And the third thing is not really necessarily in my wheelhouse, but Jan and I had a dear friend who lost her son to fentanyl-laced cocaine this summer in Ithaca, 23-year-old young man. It was very, very tragic. And it made me more aware about the crisis of fentanyl-laced drugs coming into the community. And I think that that public health has a really big role to play there in terms of outreach and education. I'm so concerned about our community, people who abuse drugs, and also people who use drugs recreationally, who may find themselves, in a life-threatening situation.
Thank you. And again, this is just the beginnings of this discussion. Obviously, people may want to mull this over a little bit and think. But yes, Sheila, you also had something you wanted to add?
Probably a standing item that we've had. Frank has been very good about giving us updates with the merger and strategic planning. So, to leave room in the agendas for that.
Mm-hmm.
That was one I was going to say too. I feel really disconnected from it right now. And I know it's partly because of COVID and all the other stuff going on, but it would be great to have just even a monthly, like 5 minutes of, here's what was done this month, or some way to get a little more information out to all of us, because it's a pretty big thing. And it would be great to better understand how it went. And also, I agree with Elise about the employment services thing. That seemed like it kind of dropped when Harmony was going to look at the contracts, which is great. And I look forward to hearing her information. But I'm just wondering in the meantime, like what are people with mental health, what issues doing for if they need employment supports? Like, did they grandfather them in, the ones they were already working with? I know there was a talk about Catholic Charities doing some kind of information about that would be great.
Yes, Jackie.
This isn't a topic, but about to have a conversation with Christina Moylan, who's the chair of the Board of Health, around the bylaws questions. But one of the things that had occurred to me and I was going to ask her about was whether they're having any conversation in their committee about any kind of joint meetings. And as I hear people talk about some of these topics, and as we identify them as public health issues, I'm wondering if I'm just thinking we should kind of keep in mind, is there a topic or two in this that a few months out, so people have time we can actually find a time where we could all meet together? But are there some things that maybe we ought to try to have a couple of joint meetings a year or something around some big topics, even though we're not merging the boards?
I think that's a great idea.
Okay, good. Again, lots of nodding heads. So I think a lot of people agree with that. Sounds like a really positive suggestion. Yes, Mary.
Just a thought about the priority plan and maybe revisiting that and see where things stand in the different areas of need that we talked about. I assume we'll be looking at a process again sometime this year. So it'd be good to stay familiar with that.
Great. Travis, if this were an auction, I would have called on you next, but it's not, so I won't. Okay. Great. Well, any other thoughts that occur to people? As I said, we'll probably put this on the agenda again briefly next month, just so we kind of have things percolate over the next few weeks before our next meeting. Other than that, we have completed all of the items on our agenda. Is there anything else that we need to do tonight, or would someone like to make a move to adjourn the meeting? A motion. Yes, Kaki, excellent. Do we have a
I'll move.
I'll move.
Blair?
I'll second.
Excellent. So we are 9 minutes early.
Good work.
Thank you,
Good,
everyone.
good job, new chair.
Yay.
Happy New Year, everybody.
Happy New
Happy New
Year.
Year.
Happy New Year.